Hello dear friends, I am Dr. Azarbani and in this video we will learn more about rash in HIV. A rash is a common symptom of AIDS. It is capable of helping to diagnose the disease and generally appears 2 to 3 weeks after infection with the virus. However, a rash can also be caused by other, much less serious factors such as an allergic reaction or a skin problem. If you suspect, consult a doctor and ask for a test to confirm the presence of AIDS. With this, you will receive the appropriate treatment for the condition. Let's see how to recognize the symptoms. Check whether the skin is red, irritated, and very itchy. The rash caused by AIDS often leaves marks on the skin. In lighter people, it will be reddish. In people with darker skin, the rash will be a bit purplish. The severity of the rash varies from person to person. Some patients suffer from very severe rashes affecting a very large part of the body. In others, the problem is much smaller. If the rash is a result of antiviral medications, it will leave the skin on your entire body irritated and red. This problem is called pharmacodermia. Do the rashes appear on the shoulders, chest, face, upper body, and hands? So, they are probably caused by AIDS. However, they tend to disappear within a few weeks. Some people mistake the AIDS rash for allergies or eczema. The rash caused by HIV is not contagious, so there is no way to transmit the virus through it. Confirm the presence of other symptoms. Nausea and vomiting, mouth sores, fever, diarrhea, muscle pain, cramps and body aches, swelling of the glands, blurry vision, loss of appetite, joint pain. What are the causes of the rash? Generally, rashes appear after a drop in the number of white blood cells. This problem can appear at any stage of AIDS, but generally you will notice it 2 or 3 weeks after infection. This phase is called seroconversion, that is, when HIV becomes detectable via blood test. Some people skip this step and develop rashes in the later stages of the virus. Such rashes can also be caused by a drug reaction. Medicines such as lomprenavir, abacavir, and nevirapine often cause this problem. During the third phase of HIV infection, the cause of the rash may be dermatitis. This type of condition is very itchy and has a red or pink appearance. This rash can last from 1 to 3 years and is usually found on the genitals, armpits, chest, face, and back. If you are HIV positive and have herpes, you may also experience these rashes. Receiving medical treatment. If the problem is mild, get tested to confirm whether you have AIDS. If you have not yet received a diagnosis, it is essential to clarify your doubts. If you don't have the disease, your doctor will determine whether the rash came from an allergic reaction to food, medication, or other factors. Don't forget that the problem could also be eczema. If you are HIV positive, your doctor will probably prescribe medication to treat the disease. If you are already taking an antiviral and the rash is moderate, your doctor will tell you to continue taking the medication, as the irritation should disappear within a week or two. To reduce the rash, especially the itching, your doctor may prescribe an antihistamine such as Benadryl or Atarax, or a topical corticosteroid. If the problem is serious, seek medical help immediately. The rash may appear accompanied by other symptoms of the virus, such as fever, nausea or vomiting, muscle pain, and mouth sores. If you have not yet been diagnosed as HIV positive, it is essential to resolve your doubts with a blood test. Based on the results, the doctor will prescribe the best treatment for you. To support my channel, please subscribe, like the video, and write your opinions. Thank you. Make an appointment with a doctor if your symptoms worsen, especially if you are taking medication. It is possible to develop hypersensitivity to certain medications, which can make both AIDS symptoms and the rash worse. The doctor will advise whether you should stop taking a certain medication and also prescribe alternatives. Hypersensitivity symptoms usually disappear within 24 to 48 hours. There are three categories of AIDS medications that can cause the rash. Non-nucleoside reverse transcriptase inhibitors, nucleotide reverse transcriptase inhibitors, protease inhibitors. Non-nucleoside reverse transcriptase inhibitors such as nevirapine are the biggest cause of rashes. Abacavir is a nucleoside reverse transcriptase inhibitor and can also cause the same problem. Amprenavir and tiprenavir are protease inhibitors, but they may also be responsible for the appearance of the rash. Don't take any medication that causes allergic reactions. If your doctor tells you to stop taking it, do so. Otherwise, the reaction may progress and become much worse. Talk to your doctor about bacterial infections. People with AIDS often have more infections than others because of abnormalities in the immune system. Staphylococcus aureus, for example, is very present in those who are HIV positive and can lead to impetigo, inflammation of hair follicles, boils, infectious cellulitis, abscesses, and ulcerations. If you have AIDS, get tested for the presence of this bacteria. Let's learn how we can treat the rash at home. Apply an ointment. The doctor may prescribe some topical anti-allergy to help reduce itching. You can also purchase an antihistamine to ease the symptoms of the rash. Apply the cream according to the instructions on the leaflet. Avoid direct sunlight or very low temperatures. Both factors can worsen the condition. When leaving the house, apply sunscreen and wear pants and a long-sleeved shirt. In cold weather, dress warmly. Take cold showers. Hot water will only irritate your skin even more. Forget about hot baths for now and always prefer to use cold or lukewarm water. Avoid rubbing injured skin, just tap the area a few times to clean it. Immediately after showering, apply a natural moisturizer containing aloe vera or coconut oil. The top layer of the skin works like a sponge, so after the stimulation your pores received in the shower, applying a moisturizer will help prevent the area from drying out. Start using natural or herbal soaps. The chemical substances found in conventional products can irritate the skin, causing itching and dryness. Buy natural, gentle products such as those made specifically for babies. Another tip is to look for soap made with herbs. Avoid products containing petrolatum, methyl, propyl, butyl ethyl parabens, and propylene glycol. All of these synthetic ingredients can irritate the skin and cause allergic reactions. If you wish, make a liquid soap at home using natural moisturizer such as olive oil, aloe vera, and almond oil. To keep your skin soft, apply an organic moisturizer right after taking a shower and throughout the day. Wear cotton clothes. If you use synthetic fibers or fibers that don't allow the body to breathe, your skin will produce more sweat and consequently become more irritated. Tight clothes can also make the situation worse by rubbing against your skin all the time. Keep taking antivirals. Medication prescribed by your doctor must be taken as directed. They will improve your T cell count and also treat rashes as long as you don't have any allergic reactions.